Now it's time for How Good and a special letter. Dear Simeon Brown, do you know how good it would be if you could find $7.5 million to help our dying children? As Health Minister, I want you to know that children are dying nearly every day in this country, and most of them are suffering when they don't need to. So, Simeon, it would be incredibly good if you could find a little bit of money to prevent this. Minister, 360 kids die of illness every year. That's things like cancer and rare diseases and rare syndromes. And right now, many of them are going through unnecessary pain because there is only one publicly funded doctor specialised in end-of-life care for kids. A single doctor for the entire country. To be clear, Minister, a child can be terminally ill and die in this country without getting what's called paediatric palliative care. It is care made specially for kids that makes the end of their life the best it can be. I'm sure you agree, Minister, that our kids deserve to have a pain-free death and to be able to die at home if they can. Every Kiwi kid should be able to die with dignity. So guess what, Minister? Here is the positive news for you. Here is the solution for you. The experts say this can be fixed with just $7.5 million a year. Now, Minister, I know that you are overwhelmed with complex and expensive problems in the health system. I just want to make sure you know that our lack of paediatric palliative care is not one of them. This can be solved with just $7.5 million, literally a rounding area out of the something like $30 billion that gets spent on health every year. I've read the reports and spoken to the experts that are submitting to Health New Zealand, which is currently consulting on what's called models of care for how paediatric palliative care service could look. Minister, a heads up, this consultation closes on Friday. You could demand a briefing on it next week if you want. But I will give you the information you need now, Minister. There is a 4-hub model proposed by your officials that would put 2 doctors in Auckland, 1 in Hamilton, 1 in Wellington, and 1 in Christchurch. They would have supporting crews. This would finally cover the country. Ray Kotuku, the Wellington charity currently filling in the gaps, estimates this would cost $7.5 million a year. That's all. This model is the way to go, Minister. Simeon, I will be straight up with you. Your Health New Zealand officials have been working on this for ages. The health bureaucracy has more than enough information to get cracking on this. This is urgent. Kids need this now. Maybe it is time you added your own energy and impetus as a minister to this and just stepped in and told them to get this sorted. And Minister, there is so much bad news coming out about the health system. Here is your chance for some good news. There's a budget coming up in a couple of weeks that will be full of cuts by the sounds of things. Giving this $7.5 million a year to the 4-hub model for paediatric palliative care would at least be what's called a good news story. So, Minister, there is your solution and your chance to do something positive in health. Simeon, I will leave you with one last thing and be as upfront as I can. What is currently happening to these kids and their families is inhumane in a modern, functioning Kiwi society. Please fix it.